Frustration over health issues can sometimes crop up in the most unlikely places, like this recent meme about dream Disney princesses, which led the following tweet. It read, "We need a Disney princess with chronic UTIs who goes to the doctor, and the doctor tells her to always pee after sex, and the princess says she's already doing that, and the doctor says, well, that's all the advice I have."
Aww.
And let me guess, the princess's name is Chlamydia.
Well, this tweet went viral with several women responding with their own UTI horror stories, pointing out how difficult it is to get proper treatment
Oh, I think
for
it's kind of nerve.
UTIs.
I think a lot of women that resonated for them, and we're always talking about the idealized Disney meme. This is kind of the reality for many women, that it's so frustrating when you have this problem over and over, and you feel like you're not getting any advice other than just to pee after sex. And I think that's good advice, but I think, Dr. Nita, you're the expert on this. Some other really good tips are out there.
Yeah, absolutely. Well, first of all, I'm sad that women feel like this, but when you are at home, there are things you can do to prevent a urinary tract infection. You want to make sure you're drinking lots of water, empty your bladder. You can wipe from front to back instead of back to front, and also wearing white cotton underwear. Things you don't want to do. You don't want to hold your pee for long periods of time or wear tight synthetic underwear. And you also want to stay away from a lot of scented soaps and bubble baths and things. So when we think about why women get urinary tract infections frequently, we think about our anatomy. The woman's urethra is just really short, and it's close to the vagina, and then you have the rectum, the anus there in that area also. So it's really easy for bacteria to travel to the urethra, travel up your urethra, and get into your bladder. And that's why you can get a bladder infection so frequently. A lot of times people will talk about drinking cranberry juice, but there's actually very little evidence that it reduces the chances of a urinary tract infection. What I will also say is you want to make sure that's what's really going on, because sometimes you'll think you have a UTI, but you really have something else. So when you go to the doctor, they should be testing your urine. If you have an infection and you're getting them frequently, they should also do a culture and sensitivity to make sure the antibiotic they're giving you is the appropriate one to treat your UTI, because sometimes you can have a resistant bacteria in your urine, so that antibiotic isn't going to do any good. And also, if you don't have a UTI, what else could be going on? There are other things like sexually transmitted infections or just vaginal infections like yeast infections. Sometimes, people will have diabetes, so they'll have a lot of urinating, or they will get frequent UTIs because it's more common in diabetes. There's something called interstitial cystitis, where women urinate a lot because it's chronic inflammation of the bladder. So there are a lot of other things. Also, postmenopausal women with vaginal atrophy, thinning of that skin, that mucosa, because of the lowered estrogen, will tend to get more frequent UTIs because the tissue isn't as healthy down there. So sometimes giving a little vaginal supplemental estrogen, if she's a good candidate based on her past medical history, can be helpful. So there are a lot of different things, but make sure it's a UTI. I'm so sorry they're just telling you to pee after sex, but I promise there are doctors out there who can help you feel better.
Well, you just gave them all the right information.